All right, and I'm going to do the Wizard of Oz version in 5 to 10 minutes, so that there'll be an opportunity for everybody to ask questions. My name is Faye Dixon. I've been a clinical psychologist and clinical researcher for about 20 years. However, today was my 4th day at the Mind Institute. So I am going to be doing actually a slightly different presentation, which is good because there are lots of students here, whereas I'm really going to be giving you kind of the more didactic model of ADHD and really telling you kind of what it is, and you guys are going to be taking mad and furious notes, and then just very briefly talk about the research project that I came here to join at the Mind Institute. Okay, what is ADHD? It's a neurological condition that involves problems with inattention and hyperactivity and impulsivity. And we're talking about levels of activity and inattention that are developmentally inconsistent with the age of the child. However, it's really less about attention, and it's more about the developmental failure of the brain circuitry, the wiring that helps to monitor inhibition and self-control. So it's really this loss of self-regulation that compromises the brain functions that are crucial to attention and behavioral control. Okay? This is kind of the historical timeline, because I know people talk about ADD, ADHD. There have been a number of different names for this condition, over time, beginning at the, beginning of the last century, up to the current. But the current diagnostic disorder is attention deficit hyperactivity disorder, and I'll explain in the next slides kind of why sometimes you get some different names. Okay? The core symptoms are inattention, and hyperactivity and impulsivity. So it's those inattentive symptoms where people will sometimes say, oh, this person suffers from ADD. That was kind of the old name. And they're frequently talking about a child or an adult who has a lot of the inattentive symptoms, whereas the hyperactive and impulsive symptoms are what we think of what people think of when they think of ADHD, but it is this entire core symptom area that represent the disorder. Some of the inattentive symptoms, and I'll just go through them quickly, of inattention, it's having difficulty paying attention to detail, having difficulty following through or finishing tasks, difficulty with organizing, having a hard time and not liking so much things that require you to kind of be focused and persevere in activities, forgetting things. And then the hyperactive and impulsive cluster are, I think, what people think of more in terms of, kind of having, the wiggles and having trouble kind of motorically, maintaining focus, sort of seeming as though a child or an adolescent or an adult is kind of more on the go, talking excessively, having difficulty in, inhibiting impulses. But the slides that I just showed, are sort of the symptoms and sort of the kind of more overall, kind of overarching difficulty are what we think of as deficits in executive functioning. And so rather than going through all those, what I want you to think about, it's really having difficulty with organization, with planning, following through, and especially using cues in the environment to shape and change your behavior. So it's kind of like not making the same mistake over again. It's having an experience, having a consequence, good or bad, from that experience, using that information to then plan your future behavior. So it's that kind of executive function impairment that is really the hallmark of ADHD. And so the other pieces are, the symptoms in terms of what parents or teachers may actually see in their home or in a classroom. In terms of the demographics of ADHD, we're talking primarily about 3 to 5% of school-aged children. The ratio of males to females, it varies widely depending upon the research studies that have been done. Although we really know that the ratio of males to females are closer in terms of being more equal. Males and females are equally affected. However, their presentation is different, and there are symptoms that may emerge earlier in boys, and there may be different types of symptoms that emerge for girls, which is why there's this difference in thinking, oh, perhaps it happens more in boys or less in girls. But the rates are actually much more similar than previously thought. The higher number of males may be due to who gets referred first. And girls typically are diagnosed at a later age, may have more inattentive type symptoms and less hyperactive or impulsive symptoms. And there is a strong link between having ADHD symptoms and also having school difficulties, or having anxiety or mood symptoms, or also having conduct or behavioral problems. Not all of those occur with ADHD, but those are certainly conditions that can coexist. And in terms of the course of the disorder, and I feel like I'm talking too much to people here, but I'm trying to see the slide. Over time, what you see is that the difficulty with with inattention and remaining focused, that stays about the same during the course of the disorder. However, impulsivity and hyperactivity decreases with age. That is, as you get older, there is a greater likelihood that the hyperactive and impulsive symptoms will begin to drop out or not be as prominent, whereas the inattentive symptoms tend to continue over time. So that you can see that in terms of outcome, there are about 30% of children as they grow into adolescence and adulthood who, the term I like to use is that they manage the disorder. They get good treatment. There are a number of factors that actually help them to function extremely well going into adulthood, but it's what people in the past have said, oh, they kind of outgrow it. And it's not so much an idea of outgrowing the disorder as much as managing it really effectively and getting really good treatment. But about 40% of children and adolescents will have continued challenges of varying degrees, and then there is about 30% of children or adolescents who, as they go into adulthood, may actually have some increase in difficulties, some of them being issues with alcohol or substance abuse, relationship difficulties, employment.